Hello, thank you so much for having me today. My name is Morgan Gorris. I'm a staff scientist at Los Alamos National Laboratory. Excited to share our work among a variety of collaborators in the Southwest on valley fever in New Mexico. And I also just want to point out that Dr. Paris Salazar-Ham from New Mexico Tech is here in attendance today too, who is a pivotal teammate on this work. So some folks are shocked to hear that a place like Los Alamos National Lab would be interested in One Health, but One Health is really critical for protecting national and global security. If our frontline defense is recognizing disease cases in humans, we are too late. And I think the COVID-19 pandemic really exemplified this for us. We know that animal, ecological, and environmental surveillance serve as great early warning indicators for emerging threats and potential pandemics, and this enables us to create vaccines and therapeutics well in advance, as well as plan out enhanced surveillance efforts. And really, from all these different data streams, we need a global, unified One Health surveillance system to pull this information together to get a better understanding of the broader risk of diseases. And I'm glad to see this and data sharing as a theme throughout most of the talks today. So to exemplify this, I want to share our story on studying valley fever in New Mexico. So valley fever, or coccidioidomycosis, is an infectious fungal disease that humans or other animals can contract when they inhale the fungal spores called coccidioides. The disease is not spread from person to person, so cases are a direct result from environmental exposure. Once you inhale the spores, about 40% of people will develop symptoms that start initially very similar to the flu. The disease can progress throughout your body and cause severe morbidity and even be fatal. On the right-hand side graph, you'll see that the number of cases reported in the United States is increasing over time, which is causing concern. Now, the first valley fever endemicity map came out in the late 1950s and was based on skin test studies. And you'll notice the areas that are darker on the map have higher skin test reactivity, and here we'll interpret them as the more endemic areas. So the Central Valley of California lights up, South Central Arizona lights up, and you'll notice that New Mexico here, almost 80 years ago now, is depicted as low endemic. Fast forward to now, this is the current CDC valley fever endemicity map, where the areas in orange are where they depict coccidioides most likely living. And again, most of the state of New Mexico is highlighted in this map. So what's really curious to me is that when you look at a map of valley fever incidence, or cases normalized by population, there's some big differences across states. Again, the Central Valley of California is highlighted here, South Central Arizona, but then there's a drastic difference between the Arizona-New Mexico border. So I'm interested in understanding what is driving this difference between states. So to start looking into this, we conducted the first epidemiological analysis of valley fever cases in humans in New Mexico. We reviewed just over 1,500 electronic health records from 2006 to 2023. And found that the mean annual cases were at about 86 cases per year in the state. On the right-hand side graph is our annual case counts over our time period. And of note is that cases increased by over 300% from the first 5 years of our time period to the last 5 years of our time period. We had hospitalization data for 40% of cases, but of those, 70% of folks were admitted to the hospital. So that tells me that the worst cases were really the ones getting reported to the system. And from this study, we really have evidence that New Mexico may be the third most endemic state for valley fever, following after Arizona and California. Now, when we plot these cases out on the map on the left-hand side, no surprise here, we really get a map of county-level population, which I put on the right for reference. The county in the more northern part of the state is Bernalillo, where Albuquerque is, and the county highlighted in darker red on the bottom part of the state is Doña Ana, where Las Cruces is. But when we plot out case incidence, we get an interesting story here, where incidence is really highest in the western part of New Mexico. Case incidence across counties ranged from 0 to about 10 cases per 100,000 population per year. Of note, a couple counties on the eastern part of the state have very low populations but still had cases, so they're highlighting as higher incidence. But this is starting to give us a more complete picture. In addition to this, recent environmental surveillance also supporting endemicity in southwestern New Mexico. So Dr. Salazar-Ham tested rodents archived in the Museum of Southwestern Biology and found positive rodents that are depicted as circles on the map. And Dr. Adriana Romero Olivares went out and did the first soil sampling testing for cocci in the state and found positives outside Las Cruces, and that's marked in the square on the map. So together, the case surveillance information plus the environmental surveillance really are showing a more complete picture of valley fever risk in New Mexico, highlighting the western part of the state as higher risk. This physical evidence from environmental surveillance can then support future human and animal case surveillance efforts, so we're hoping this acts as a positive feedback loop for us. And it also leads to additional research questions like, is there a different strain in New Mexico that's less virulent or less infectious? Do environmental conditions cause less exposure? Though if you look at the pictures on the right from our spring last year, you'll notice we are at quite a dusty state too. Or are we potentially underreporting or misdiagnosing cases in the state? So I hope this example gives some support for creating a unified One Health disease surveillance methodology so that we could pull all these data streams together and give support as One Health surveillance protecting global security. Thank you.